Hello friends, I am Dr. Ashish Sarwal, Urologist, Prostate Cancer Specialist and Robotic Surgeon from Apollo Hospital, New Delhi. Today I am presenting to you Mr. MV. He is a patient from Cameroon and he was referred to me by the medical tourism company Lyfboat for prostate cancer treatment. Since I am a prostate cancer specialist, the Lyfboat always refers to the best doctors in different treatments, and that's why they refer to me. And now Mr. MV is about 10 to 15 days after his robotic surgery for prostate cancer, and now Mr. MV is just 10 to 15 days after his robotic surgery from prostate cancer, and he's flying back to his country tomorrow. So we requested him to give a interview and tell his experience how the recovery was. I always tell in my videos, if you see my direct videos as well, that I always tell robotic surgery is a very good treatment for prostate cancer and it is safe. But here we have Mr. MV. He is 10 days after surgery and he wants to tell his whole experience, how everything happened and how he is feeling after the surgery. Yes, please.
Good, I'm Dr. Mve, from Cameroon, and facing the issue of my prostate cancer, I went to the internet, put in some keywords. That's how I came across Lyfboat. And Lyfboat has been determinant in this whole process. First of all, before coming to a country, you need a visa. So they were involved in the visa issue, the medical visa issue. When I even faced some problems with the online payment of the visa, they were ready to pay it for me. Finally, eventually, my card was normalized and then I paid. When I got to the airport, they were there waiting for me. My name was out there, and then they took me to the hotel. And of course, during this whole process, they have been around, taking me to the hospital to meet Dr. Ashish, taking me back to my hotel after I was discharged from the hospital, and they will still take me to the airport tomorrow as I'm leaving the country already. So they were determined. I would like to add some things. It is confidence, because I never met Lyfboat before. It was really a matter of internet. So, but everything which was, proposed was done. And I've been really 100% satisfactory with this Lyfboat, that supporting team. That's how they told me that they are called. So I'm advising most of the people to trust Lyfboat. It's not a joke. It's because of them that today I'm free of my disease. And the doctor comes later on, but before the doctor, you have to meet a team which may do everything, all the accommodations, the hotel, the visa, in fact, even your stay here, going up and down. So I also like to thank Lyfboat. They have been determinant, very determinant. Mr. Manish, for example, took me from the airport. The other one is, I think, Guraj, who was up and down with me. But there's one I didn't see. I wish I have seen, the one who was taking care of me for the hotel and for the visa. Therefore, really, thank you, Lyfboat. They are efficient, they are trustable, and I'm satisfied 100%.
Yes. So we will just go a bit more in detail about the recovery. What patients ask me is that, how will I be immediately after surgery? So immediately after surgery, when did you start eating? When did you start walking? All those things, please tell.
Good. After surgery that very day, the next day, of course, that night, because I was operated the given day, and that night I didn't eat something, but starting from the next day, I could move on. I even started eating quite quickly. And really for me, apart from the moment I spent during surgery, I have no souvenir of something changing with my own life. I started with liquid, food, and then I quickly continued with normal food. Right from, I think from the second or third day, I could eat already. Yeah. And of course,
you were walking normally? There was no
yes,
problem?
I was working normally, and the whole process was painless, so to speak, because of course, they took care of the pain during surgery, and there was also some post-surgical treatment taken into account, my pain. So for me, it was an experience really unexpected because we conduct surgeries, but when you go through yourself, you don't know that thing is finally so easy.
Yeah.
Yeah.
So you also had a catheter.
Yes, I had a catheter which was kept intrauterine catheter for 13 days. And
how was the experience about the catheter? Like, was
well,
it painful?
No, it was not painful, although the sensation was quite unexpected because it was as if I was having a sort of foreign body in my body. But it seems as if the body quickly got into account that I had it, so I could move throughout daily with that intrauterine catheter to do my other things, because you cannot come this far in such a great country without having an opportunity to visit here and there. So for me, keeping it that long was not the issue for me. Yeah.
Yeah, so since you were from outside, we took extra precautions and kept the catheter for a little bit longer.
Yes.
Normally, we keep the catheter for 7 to 10 days.
Yeah.
But I thought that since you're here, you're waiting, let us keep it for 1 week extra.
Yeah, and I will tell you, doctor, if you decided to take it away before the 14th day, I would have refused.
Okay.
Because I want you to give myself all the chances.
Yeah. So, right. And so basically, after discharge from the hospital, you were walking, everything was fine. You had any problem in doing any work?
No particular problem. I stayed in the hospital for 3 days. And I was discharged, I think, on the third or fourth day after surgery. And I was quickly independent. I would just let people to know that I came alone.
Yeah.
I came alone, I was alone. So, but I was not alone at the end because of the management which was conducted around me. I won't even talk about the day I was operated upon. There was someone who was sent to stay with me. And I was so independent that I didn't need someone after that surgery. And this was the amazing part of the surgical result. See?
Very nice. So after that, while you were in the hotel, you were comfortable walking around, going around everywhere, doing sightseeing, right?
Yeah. In my hotel, I was, as I said, independent, and I could go up and down, and I even went to town, doing other things, because I had some visa issue. Then I had to move up and down. A few days after my surgery, it was amazing, really.
Nice. So then the day came when the catheter was removed.
And then I came, and Dr. Ashish moved the catheter himself. And that very day, there was some sort of slow leaking, urine. But right from the second day, I could already keep some urine. I even told him that I could keep something like 10 cc's at the beginning. Today, I'm almost back to my rhythm before surgery. That is, I can go out. Just to give you an example, I visited the Gate of India, stayed out there for 2 hours, but I could keep the urine. And really, I think that it was something very good for me to choose robotic. We know what it is. I'm not a robotic surgeon, but we know the advantages brought by them. And I went through the great experience of Dr. Ashish, let me tell you that. So I'm really amazed until now, really, from the bottom of my heart.
Yeah, so see, the thing is that I always tell my patients that we take special precautions for urine control because we think that just removing the prostate is not the only thing. We have to take special precautions to improve the quality of life of the patient. And urine leakage is something which is not acceptable to anybody. Some people, they think that maybe urine leakage you will accept it, but still, if they have a result with no urine leakage, that is what we always aim for. For that, it is not only robotic surgery. I say that it is not only the machine, it's also the man behind the machine. So the robot is the same in many hospitals, but how trained you are, how well you're doing the surgery, how frequently you're doing the surgery, what are the special techniques the doctor is using. Like when we do the surgery, I do hood technique in which we don't disturb the ligaments and the muscles around the prostate, and we just remove the prostate out. We don't cut any of the ligaments. We do nerve sparing, in which the nerves for urine control and erections are spared. And also we put the amniotic wrap, in which the amniotic membrane, human chorionic amniotic membrane, is put over the nerves during surgery. That's a synthetic membrane, and that helps in quicker recovery of the urine control and the erections. So we used all those techniques on Dr. MV also, and so he's himself telling that now it is 3 to 4 days after the catheter removal and he's very comfortable. He's moving around just like as if he didn't have to have any surgery and just like pre-surgery state. So this is what the advantage. Normally I tell the patients that 3 to 6 months it takes for the urine control to come back, but for him in 3 to 4 days only the urine control is back. And since I've started using the hood technique, this has happened. Like frequently I'm seeing patients within the first week only they get their urine control back, and he's a live living example of that.
Yes, I can confirm. Really, I'm sitting in front of you talking about myself, and myself being a medical doctor. What I'm living now, I even wrote to him that it is almost close to the way I used to control my urine before I was sexually upon. Yeah, I confirm.
So then finally his biopsy report also came. Now this is very important because when he came, his story is that he has a very strong history of prostate cancer. His father and many relatives had prostate cancer. His PSA was rising. 2 years back he did a PSA which was 6, then he ignored it, and then did a recent PSA which was 18. So such a rapid rise, and we did the surgery and the biopsy report showed that he has a Gleason 7 cancer, 3 plus 4, 7, and also at one part it is going outside the prostate. So people who think that prostate cancer is slow growing and we can ignore it, he waited for 2 years, and within 2 years the PSA rose to 18 and cancer started to go out of the prostate. So will you tell something about this thing?
Yeah, I really want to say something, and I say a lot because we discussed before I came concerning what was the management. We go through the whole checklist, so to speak, biopsy, going up and down. No, I was so happy to find that we took into account my medical history. And of course, everything was confirmed by the biopsy. And I remember yesterday when you gave me the result, you looked at each other when you say it is cancer, and we were all happy that knowing that it ought to be cancer. So what I want to emphasize here is that really it was so fast, the management, because the next day I came, I was planned to be operated, I think, after 24 hours.
Yeah.
And things went that way. And above all, something I really want to, talk about here is that since I came alone, then I was alone. Although I say that I was not alone because people were around me in the hospital, but there was a team. There was a WhatsApp group that really marked me a lot, where my wife, my children were involved, and they could sort of live, having the feedback and the update. This is what I'm bringing back, really, because I won't tell you, my wife is a nurse. So for her, it was so difficult to stay very far from me when I needed her a lot. But I had that family, and this is for me, even myself, I've never done it as a medical doctor. So really, thank you very much for all these facilities. And you can come alone, you can come with an attendant. Really, if perfection belonged to this world, I would say that I went through perfection. Thank you once again, Dr. Ashish. Yeah.
So the next question is that the patient asks that, now what is the further course? Now the surgery is done, prostate is out, biopsy has come, now what? The next point is that you have to do a PSA. It is a cancer. You cannot forget that it can come back anytime. So you have to do a PSA test, and target PSA is less than 0.1. I have told Dr. MV also that if the PSA anytime rises, then he has to consult me and we will do some further tests and see what the cause is, and accordingly we'll treat. But otherwise, every 3 months, 6 months, you should repeat a PSA. As long as the PSA is less than 0.1, nothing to worry.
Yeah, I've been told all this, and as a matter of fact, as we just said, I have a very strong family history. So I will abide by all those recommendations to be sure that I'm free of cancer, because everyone knows what is cancer. Life is good, everyone wants to live longer. So I will do my PSA regularly every 3 months. And as soon as something is done, he even told me that I can let him know, so that if, for example, there's hormonotherapy, we may still get some of the treatments from here.
Yeah, that we can do.
Yeah.
So since patients are coming from far off, they often ask me that, after surgery, how frequently we have to come for follow-up, because just coming for surgery and going back, so it would be a hassle for them to come all the way again. So after successful robotic surgery and prostate cancer treatment, when the cancer is out, PSA 0, all the time we support by WhatsApp, and patients don't need to come. You have to just send your reports of PSA. If everything is fine, then you just have to follow with WhatsApp messages after 3 months. You don't have to come all the way to India every time, every 3 months, every 6 months. Even I have patients who have done surgery like 7 years back, 10 years back, and they've never come back after that, but they are in constant touch with me through email or WhatsApp. So thank you, Dr. MV. I treat many patients, but there are very few doctors who also are patients, because they're also human beings and they can develop prostate cancer just like anybody else. So whenever a doctor trusts me to do his surgery, I'm more and more obliged to him that he trusted me. And I'm very happy that everything is gone well. Your urine control is good, your prostate is out, your cancer is out. So hopefully in the coming years, you will get your urine control 100% back, you will have your PSA 0, and you will have an erection back, and you'll lead a normal life.
Yeah, this is what I hope, and this is what I foresee coming really. Yeah. If I take into account the fact that the urine control is getting quite quick, because this was my main worry. I was ready to go for 3 months. This is what I read in the books. I'm not a urologist, but the fact that it is coming that fast also tells me that all the other things are going to be done accordingly. I really want to say a very deep thank from my bottom of my heart. You are my savior, Dr. Ashish.
Thank you.
Really, I have kids. They were still expecting many things from me. I think you are the one who finally allowed me to keep on. Thank you.
So friends, I hope you understood his experience and understood that robotic surgery is safe and recovery is quite quick. You don't have to be scared about urine leakage and all that, because the way we do the surgery, the urine control comes back quickly. You don't have to worry, and you will be cancer free. If you're also suffering from prostate cancer and you want to consult me, then you can email me or WhatsApp me. My email address and WhatsApp number are given in the description. Thank you. Tell us something about your treatment as well.
Yeah, the treatment by itself, of course, I was taken to Yatat Hospital, where Dr. Ashish took care of me, and then I was discharged 4 days later, then taken back to my hotel. But during this whole process, Lyfboat was around, taking me here and there. When I first met Dr. Ashish, they were the one to take me from the hotel to the Apollo Hospital, where we met. So now I'm on the verge of leaving this great country of India. I tell you, yesterday I did my tourism, and I think Lyfboat should keep on saving people, because this is, everyone knows what is cancer. When it came across, really I was lost. Asking myself what to do. And thank you, Internet, because that's how I discovered them, just by a keyword. And I will just bring my testimony to say that they are really efficient. They are fast, their efficacy is there. Thank you once again, Lyfboat.
Mr. MV from Cameroon, he's a gynecologist by profession. He's himself a doctor, and he was diagnosed with prostate cancer stage 2, PSA of 18, and he had a Gleason score of 7. So it was a localized cancer which was not spread anywhere in the body, and we did a robotic radical prostatectomy with bilateral pelvic lymph node dissection 2 weeks ago. He recovered well. He did not need any blood transfusion. He did not need any ICU stay. He was straight away shifted to the regular room, and after 3 to 4 days, he was discharged from the hospital. After 10 days, we removed the catheter, and today he's 4 days after catheter removal. He's doing fine. He's roaming around in the city, and he does not have much urine leakage. He's quite continent, and he's very happy with his recovery, about the urine control and also about the cancer cure. I would like to add that for urine control, we do nerve sparing surgery, and we do the hood technique, in which we don't remove the muscles and ligaments around the prostate. We just save the muscles and ligaments. That's the hood technique, and that helps in early return of the urinary control and erections. And also we use the amniotic wrap, which causes quicker nerve regeneration. So if you are also suffering from prostate cancer, you want the best treatment, from somebody who's an experienced robotic surgeon. I trained in US from 2008 to 2011, and after that I came to India and doing the surgeries. So if you want to consult me, you can contact Lyfboat and then get back to me. Thank you.